has not had an opportunity to speak today. That's a physician voice. We've heard from administrators and executives. We haven't heard from physicians, and by the way, we're all patients. So I think I speak for the patient and I speak for the physician. First of all, full disclosure, my group, clinical practice of CentreState, is one of the original patient-centered medical homes in the state of New Jersey. We've had a long-standing partnership with Verizon, and we've been recognized, and we are a patient-centered medical home, level 3 NCQA certified, so we've achieved the highest level of certification there is. I've enjoyed my partnership with Verizon and meeting with them, and we have a lot of great discussions on improving quality and saving costs. Everyone today has agreed on the same goal. You know, let's lower costs, improve quality. But it is very confusing for the consumer, I agree. As a physician, and I have practiced my career in the inner city. I've been in Burlington County most of my career, in Trenton, and been in Monmouth County, Western Monmouth County for the last 3 years. Western Monmouth County also has a big donut there. There's nothing there. CentreState is the only hospital in Western Monmouth County. We serve as a very large geographical area, very diverse. We see patients of all backgrounds and ethnicity, and certainly socioeconomic status. We're the only, one of only 3 systems in the entire state that offer a high level of care for MS patients. We are the only hospital in Western Monmouth County to offer inpatient psychiatric services. And this was mentioned earlier about the really lack of a lot of insurance coverage for mental health in the state. We're the only inpatient service for obstetrics and gynecology in Western Monmouth County. Therefore, we also are experiencing the same problems here. What's interesting is I'm tier 1, my practice is tier 1, my hospital is not. I have an office that's literally attached to my hospital. And I have patients that have MS that are brought into me in wheelchairs. And a lot of them have Blue Cross, Verizon Blue Cross products. You know, and I have to say to them, well, yeah, of course I want you to get down and offer services. And they tell me, this is real. Doc, just can't do it, can't afford it. You know, I don't know what I'm going to do, but I have to go somewhere else. That's really, you know, it's really sticking a dagger in the heart of what I try to do every day. Let's take care of people. You know, we can't do it when there's a division there. And I understand there's choice. We have choice. Well, my patients had choice of taking Verizon Advantage GPO plan, you know, over the last 2 years. I was in network. They said, great, we're going to join with you. I saved them money, provide high quality. I then got a letter at the beginning of this year. Sorry, CentreState is no longer a provider in our EPO plan. My patients were forced, not choice, forced to leave my hospital system because I take what my hospital takes. I'm employed. So if I'm an employed physician, by the way, 50% of doctors in the state are now employed, and that's growing. You know, so we're going to have a huge chasm between physician and hospital, and more importantly, between our patients and our physicians. We strive to practice quality. We care so much about our patients. The margin in family medicine is so small. 1 patient per day. That could be 100 hours a day, extrapolated over 365 days a year. The margin just isn't there. That's an employee or 2 that I have to fire because I can't make up the difference. And this is real. It's real information. It's in the trenches. I'm not saying this for any reason, but we got to look at this. So I propose, and I like the comments before about taking this back to, to the committee and looking at this. To me, if everyone had the same bar, for me to be NCQA certified, I have a bar that I have to achieve. I have a 100-point scale that I have to be graded on. And to hit that grade is not easy. Believe me, it's not easy. It costs us a lot of money just to get there. Everyone should have the same access, the same ability to hit that score. If this is any willing provider, that's what we're talking about. If any doctor in any hospital had the chance to do this, let them have that chance. And whether it be Horizon's product or anyone's product, give them the chance to achieve the same level. Oh, and by the way, to your comments, I am tier 1, no one approached me. No one asked me. I've talked to many of my colleagues up and down the state, hey, you're tier 1, that's great. What do you do to get it? I don't know. So I'm privileged, I'm happy. Unfortunately, I can't send my patients to my hospital when I'm on staff, so I can't manage them. By the way, when we send patients to other hospitals that are not in our system, that causes a decrease in communication. You're looking at a duplication of testing that may not have needed to be done. You're looking at a decrease in quality care. When the patients come back, if they come back, go into the competing hospital system, if they come back, we don't get that communication. We may be looking at hospitalization rates in under 30 days. Rehospitalization rates go up because we have not received the proper communication with them. So this is a potential problem that I know we could avoid. Again, these are unintended consequences. But I will close my comments there because I know it's getting late. If anyone has any questions, I appreciate it.
Any questions?